Namaste and Siddhi Pranam. Welcome to today's topic, which is postpartum changes and problems. So let's look at the physical changes that occurs right after childbirth. So after childbirth, a woman's body goes through numerous physical changes as it recovers from pregnancy as well as the delivery. So these changes are a natural part of postpartum period, and they can vary from women to women. And some of the common physical changes that occur after childbirth is uterine contractions. So after delivery, the uterus starts to contract to return to its pregnancy size. And these contractions may cause postpartum cramping. And especially during breastfeeding, this can happen a lot more. Then is vaginal discharge. So vaginal discharge is also known as lochia, and women experience vaginal discharge that consists of blood, tissue, and mucus. And it can be heavy in the first few days and gradually decreases in volume and changes the color over time. Then is perineal soreness or tears. So if a woman had a vaginal birth, she might experience soreness or tears in her perineum. The perineum is the area between the vagina and anus. So there might be stitches that might have be done in order to stitch the severe tears, depending on what kind of a tear she had, and that many stitches would have been placed in her perineum area. Then the breast changes also occurs. So the breast becomes larger and more tender as they prepare for breastfeeding, and after the birth, the breasts produce colostrum, which is a nutrient-rich precursor to breast milk. This occurs at the time immediately after the birth has happened, or sometimes even just prior to birth, the colostrum starts to come. Many mothers do also save the colostrum to give it to the child as soon as the baby is born. Then is breast engorgement. So when the milk comes in, typically a few days after the childbirth, the breast may become engorged, swollen, and also painful. So regular breastfeeding or pumping might help alleviate this pain. Then the weight loss. So women generally lose some weight immediately after childbirth due to the loss of the baby, placenta, as well as the amniotic fluid. However, it's really essential to focus on a healthy postpartum diet and exercise rather than crash dieting. And then the abdominal changes. So the abdominal muscles and skin stretch during pregnancy, and it can take it takes time for them to regain strength and firmness. Some women may experience diastasis recti, and diastasis recti is a condition where abdominal muscles separate, which requires specific exercises to help them come back together. Then is hormonal fluctuations. So hormones, particularly estrogen and progesterone, undergoes significant changes after childbirth, which can lead to mood swings and also emotional adjustments. Then is hair loss. So some mothers experience temporary hair loss or shedding of postpartum, shedding of hair during the postpartum period, which is a result of hormonal changes. However, hair typically grows back in few months' time. By the time the baby reaches the age of 1, the hair comes back usually. Then the urinary and bowel changes. So pregnancy and childbirth can weaken the pelvic floor muscles, which can lead to temporary urinary incontinence or difficulty with bowel movements. And then joint pain or muscle pain can also occur. So the hormone relaxin, which increases during the pregnancy, can lead to temporary joint and muscle pain at the time of postpartum. Then stretch marks. So many women develop stretch marks on the abdomen, breast, and hips or thighs due to skin stretching during the time of pregnancy. Then emotional changes and hormonal shifts at the time of postpartum. After giving birth, women do experience significant emotional changes, and it's really crucial for us to understand them. They are also going through hormonal shifts as their body is adapting to postpartum life, and these changes are normal part of postpartum period and often referred to as postpartum blues or the baby blues. So they can be attributed to sudden drop in pregnancy hormones and the challenges of adjusting to motherhood. And some of the common emotional changes and hormonal shifts that women may experience, first is the baby blue, as we said. So in the days following to the childbirth, mother experience mood swings. There is a lot of tears shedding, and the feelings of sadness and anxiety. And these emotional changes are usually mild and may last for a few days or couple of weeks. The baby blues are thought to be related to hormonal fluctuations and the stresses of caring for a newborn. Then hormonal fluctuation. So during pregnancy, the body produces high level of hormones, including estrogen and progesterone, which decrease dramatically after childbirth. Additionally, there is an increase in other hormones like prolactin and oxytocin, which are essential for breastfeeding and bonding with the baby. And these hormonal shifts can contribute to emotional stability and mood changes in the mother. Postpartum depression. So while the baby blues are common and typically can resolve on their own, some mothers might experience more prolonged and severe emotional difficulties, which is commonly known as postpartum depression. So PPD can manifest as intense feelings of sadness, hopelessness, or loss of interest in activities, and changes in sleep and appetite that can lead to difficulty in bonding with the baby, and even thoughts of harming herself or the baby can also occur. So it's really crucial for the mother experiencing these symptoms to seek immediate professional support. Then is postpartum anxiety. So some women may experience excessive worry, fear, or anxiety about the health and well-being of her baby and herself. And this is different from the baby blues and might require treatment and support. Postpartum psychosis. So although it's rare, but postpartum psychosis is a severe mental health condition that requires immediate medical attention, and it is characterized by hallucinations, delusions, extreme agitation, and a loss of touch with reality. Then changes in self-image, which is quite common. Many women experience changes in their self-image after childbirth, both physically and emotionally. They may have mixed feelings about their post-pregnancy body, or might face challenges related to their body image. Fatigue and sleep deprivation. So the demands of caring for a newborn coupled with sleepless night can lead to exhaustion and heightened emotional sensitivity. Then let's look at healing from the birth and birth trauma. Sometimes mothers do have birthing trauma. So healing from childbirth trauma is a process that requires patience, self-compassion, and support. Childbirth trauma can manifest in various ways, including physical, emotional, and psychological aspects. And some of the steps and consideration for mother to heal from childbirth trauma would be these. One is recognize and validate their feelings. So the first step in healing and acknowledging and validating the feeling and emotions associated with the traumatic experience is the first step. So it's really essential to understand that it's really okay to feel overwhelmed, scared, or even angry about the childbirth experience. Then if it's too overwhelming, they can always seek professional help. If the trauma is affecting their daily life, it may be beneficial to seek support from mental health professional who is experienced in perinatal or postpartum care. Therapy or counseling can really provide a safe space to process those emotions and work through the birth trauma. Then She can also choose to talk about the experience. So sharing the childbirth experience with a partner or a close friend or a support group can also help in processing the emotions and reduce feelings of isolation. Sometimes talking openly about the trauma can elevate emotional impact. You can also have postpartum groups, and if you can create that safe space for the postpartum mothers, you can create a small group where they can feel safe to discuss and express their laboring and birthing journey. And also if they have had any post trauma, which usually mothers have, some has small, some has bigger, but if they are open about it and they can communicate it, it helps them understand that they are not alone and that each mother has had their own share of trauma, and it's really okay, and they can let that go. Trauma usually also occurs because of pre-existing expectations in the mother's mind, which were not fulfilled at the time of labor and birth. So it's really important to process those feelings, and in a group setting or in a safe space that can happen. Then mothers can choose to practice self-compassion. So being kind to herself and recognize that healing takes time, it's very important. So avoiding self-blame or guilt over the childbirth experience, it's very crucial. One needs to remember that she did the best she could under the given circumstances. Then engaging in mindfulness or meditation can also really help. So mindfulness practices can help ground the mother in the present moment and reduce anxiety related to the traumatic experience. Meditation can promote relaxation and also provide emotional well-being. She can also choose to write about her experience. So keeping a journal or writing a letter to herself about the childbirth experience can be very therapeutic. It can allow the mother to express her thoughts and feelings and gain new perspective on the situation. Then she can also explore healing therapies. So she can consider exploring holistic healing practices like yoga, massage therapy, or art therapy, or acupuncture. And these practices can help release emotional tension and also promote relaxation. And connecting with other women. So joining a support group or connecting with other women who have experienced childbirth trauma can be very empowering and provide a sense of solidarity. Then setting boundaries is also very important. So if discussing the childbirth experience becomes too triggering, it's essential to set boundaries with well-meaning friends and family members who may unknowingly are causing distress to the mother. Then reframing the experience. So working with a therapist and considering reframing the childbirth experience in a way that it empowers the mothers and highlights her strength and resilience can really support in her healing journey. Then trauma-specific therapy. Some women may benefit from trauma-specific therapies like eye movement, desensitization, and reprocessing, which is EMDR. And other common therapy is cognitive behavioral therapy, CBT, which are designed to address trauma and its effect. Yoga can really aid in the healing process after childbirth and also act like a therapy. And certain poses can also target areas of tensions like back, hips, and shoulder. And there have been a lot of research going on in many universities, and one of my senior teachers part of that research where they found that one session of yoga was 5 times more effective than cognitive behavioral therapy. This is still in research, no peer reviews journals as of now, but just adding here that yoga can be very powerful as compared to other behavioral therapy at times, but it depends on the recipient. Some might respond to CBT a lot more than the yoga session, versus some might feel releasing their emotions and body tensions through yoga is more powerful experience than as compared to speaking to someone as a therapist. Yoga can also help focus on the pelvic floor muscles, which are really essential for postpartum recovery. So the mindfulness aspect of yoga can also help manage feelings of overwhelm and uncertainty that might arise during the postpartum period, and also it can help balance hormones that can contribute to improved emotional well-being. And there are practices of mother-baby yoga, which can strengthen the bond between mom and the baby. And yoga can really promote body acceptance and self-love, and also encourage mothers to appreciate their bodies for the incredible journey they have been through during the time of pregnancy and childbirth. Now, let's look at navigating sleep deprivation. Sleep deprivation during the postpartum period can be incredibly challenging, as it affects not only the physical well-being but also the emotional and mental aspects of new parents' life. Some of the challenges that arise due to sleep deprivations would be physical exhaustion. So lack of sleep can lead to extreme physical fatigue and exhaustion, and making even simple tasks feel very overwhelming for the mother. Then impaired cognitive functioning. So sleep deprivation can negatively impact cognitive functions like memory, attention, and decision making, and it can make it difficult to focus and perform daily activities. Mood swings and irritability are also very common. So sleep deprivation is associated with increased irritability and mood swings, which can strain the relationship and also affect overall emotional well-being of the mother. Reduced immune function. So chronic sleep deprivation can weaken the immune system, making new parents more susceptible to illnesses. Then increased stress and anxiety. Lack of sleep can elevate stress and anxiety levels, making it very challenging to cope with the demands of parenting. Then risk of postpartum depression, PPD. So sleep deprivation is a significant risk factor for postpartum depression and a serious mood disorder, and can affect a new mother's ability to bond with her baby and function effectively. Then impact on parent-child bonding. So sleep deprived parents may struggle to engage fully with their baby, and which can affect the bonding and attachment among them. Then accidents and safety concerns. So sleep-deprived parents may have reduced alertness that can lead to an increased risk of accident and safety concerns, both for themselves as well as the baby. Then impaired coping skills. So sleep deprivation can make it harder for parents to cope with the challenges of parenting, leading to feelings of helplessness and inadequacy, and also it can also interfere with breastfeeding. So for breastfeeding mothers, sleep deprivation can interfere with the milk production and can cause difficulties in establishing breastfeeding routine. Then strain on relationships. So sleep deprivation can put strain on relationship with partner and other family members, as both parents may be emotionally and physically drained. Then long-term health effects. So prolonged sleep deprivation during the postpartum period can have long-term health effects. If not addressed, potentially it can lead to chronic sleep issues. Some of the ways and tips to handle sleep deprivation. So first is sleep when the baby sleeps. Mom really needs to take advantage, mom or the other parent really need to take advantage of the baby's nap to get some rest herself. Even short naps can rejuvenate and help the mother to accumulate some much needed sleep. And then she can always choose to accept help and support. They should not, as a couple or the mother, should not hesitate to ask for help from her partner, family or friends. And they can really assist with baby care and allow the mother to get some uninterrupted sleep. Then creating a sleep-friendly environment. Making sleep space as comfortable as possible, and considering to consider using blackout curtains or white noise machine or earplugs to create a conducive environment for rest can really help. And then establishing a sleep routine. So develop a bedtime routine that signals to your body that it's time to wind down and prepare for sleep. This can include activities like dimming lights, reading a book, or taking a warm bath. And then sharing nighttime duties. If possible, share nighttime feedings and diaper changes with your partner. And then splitting responsibilities to ensure that both parents get some rest. Limiting screen time. So reducing screen time, especially before bedtime, as the exposure of screen can interfere with the body's natural sleep-wake rhythm and also affect the production of melatonin. This can really help in creating a sleep-conducive environment. Prioritizing self-care. So one needs to take care of their physical and emotional needs and eat nourishing foods, stay hydrated, and find times for activity that can help relax and de-stress. And choosing to avoid caffeine and stimulant can also be really helpful. While a cup of coffee might provide temporary energy boost, excessive caffeine intake can disrupt sleep patterns and also exacerbate sleep deprivation. Then lowering the expectation. So recognizing that the postpartum period is a time of adjustment and it's really okay if everything isn't perfect. Lowering expectations and being flexible can reduce stress and help you cope with better sleep deprivation. Then joining support groups. So connecting with other new parents experiencing similar challenges can be a really great idea. Whether online or in person, support groups can provide valuable advice, encouragement, as well as a sense of community. Then nap strategically. If you're not able to get full night's sleep, short powerful nap throughout the day can be really beneficial for recharging the energy. Then yoga for sleep deprivation. So yoga can be really highly beneficial in promoting relaxation and better sleep quality. And also it can help with energy restoration after the postpartum period. So when we combine physical posture, breath work, and mindfulness technique, this can all together help the mothers cope with the challenges of sleep deprivation and also replenish her energy levels. So regular yoga practice can regulate the body's sleep-wake cycle and also promote better sleep patterns. And yoga practice can also gently revitalize the body and mind for the mother. And energizing squeezes and breath work can really provide natural boost of energy without overexertion. So letting go of tension and anxiety can contribute to calmer mind, which can positively influence the sleep quality. And yoga can really help in letting go all the tension and stored anxiety in the body. Then is breastfeeding support. So breastfeeding support for mothers after postpartum period is really essential to ensure successful breastfeeding and promote the well-being of both mother and the baby. And some of the different aspects of breastfeeding support for new mothers would be this. One is lactation consultation. A lactation consultant is a trained professional who can provide specialized guidance and support to mothers in all aspects of breastfeeding. They can help with latching, positioning, milk supply issues, and also any breastfeeding challenges that might arise. Postpartum support groups. So joining postpartum support groups or breastfeeding support group can also provide a sense of community and connection with other mothers who are going through similar experiences. And sharing experiences, tips, and challenges can be reassuring and helpful. Then family and partner support. So encouragement and support from family members and partners are really crucial for breastfeeding success. So having someone to help with household chores and baby care can really give mother more time to rest and focus on breastfeeding. Breastfeeding education is also a great tool. So educating mothers about benefits of breastfeeding, proper latching techniques, and breast care can really empower them to make informed decisions and also feel confident in their breastfeeding journey. Then is prenatal breastfeeding classes. So attending breastfeeding classes can really help mothers to prepare the breastfeeding and learn different aspects of early postpartum period. And access to resources. So providing new mothers with access to reliable resources like breastfeeding helplines, website, reputable books, or can be very valuable for finding information and support. And then addressing breastfeeding challenges. So it's really essential to address any breastfeeding challenges promptly, and whether it's dealing with the latch issues or low milk supply or discomfort, and having access of professional help and advice can be very crucial in some stages. Postpartum home visit. So some healthcare providers or lactation consultants do offer postpartum home visit, which can be really beneficial for observing breastfeeding sessions in a familiar environment and also provide personalized support. And encouraging skin-to-skin contact. So skin-to-skin contact between mother and baby can really help promoting bonding and also it facilitates breastfeeding. Then breastfeeding friendly environments. So creating breastfeeding friendly environment in public places, workplaces, and community spaces can really help the mothers to feel more at ease in breastfeeding in public and normalize breastfeeding. And let's say if you're doing mom-baby yoga classes, you can probably have a dedicated space where they can feel comfortable and free to just feed whenever they want to. And then promoting breastfeeding friendly policies. So this is a matter of policies, but advocating for breastfeeding friendly workplaces policies and extended maternity leaves and accessible pumping facilities can support mothers who choose to breastfeed while balancing their work responsibilities. Then some of the key benefits of breastfeeding after childbirth would be these. So when we look at the benefits for the baby here, first, to the baby, nutrition is the greatest benefit. So breastfeed is uniquely tailored to meet the nutritional need of the baby, and it provides the perfect balance of proteins, fats, carbs, vitamins, and minerals. And hence, it really is essential for the baby. Then it really supports the immune system. So breast milk contains antibodies and other immune factors that help protect the baby from infections and illnesses, that reduces the risk of respiratory infections, ear infections, gastrointestinal illnesses, and more. Digestion is another great help. So breast milk is easily digestible for the baby, and it reduces the likelihood of constipation and digestive issues. Brain development. So breast milk contains essential fatty acids that supports brain development and may contribute to improved cognitive outcomes. Allergy prevention. So breastfeeding has been associated with reduced risk of allergies and allergic diseases in infants. Then reduce in risk of sudden infant death syndrome, SIDS. So exclusive breastfeeding has been linked with lower risk of SIDS, and then it also promotes bonding and emotional development. So breastfeeding promotes bonding and emotional closeness between mom and the baby, and it also fosters a sense of security and well-being. Then healthy growth of the child. So breastfeeding is associated with reduced risk of obesity and chronic diseases later in life for the baby. Now let's look at the benefits of breastfeeding to the mother. So first is bonding and emotional health. So breastfeeding releases hormones like oxytocin, which promotes feelings of love and bonding between mother and the baby. And it can also contribute to lower rates of postpartum depression and anxiety. Then it also helps with uterine contractions. So breastfeeding stimulates uterine contractions and it helps the uterus return to the pre-pregnancy size more quickly. And postpartum weight loss. So breastfeeding can aid in postpartum weight loss as it burns extra calories. Then reduced risk of certain diseases. Breastfeeding is associated with a decreased risk of breast cancer, ovarian cancer, and also type 2 diabetes in mothers. And convenience and cost effectiveness. So breastfeeding is convenient as the breast milk is readily available and does not require preparation. It is also cost effective because it saves money on formula and feeding supplies. Then it's a natural birth control. Exclusively breastfeeding mothers can provide a degree of natural birth control known as lactational amenorrhea method, LAM. Although it is not foolproof and relies on specific condition being met, but it can in many cases act as a natural birth control. Then there are long-term health benefits to mother. Breastfeeding has been linked to improve long-term health outcomes for mothers, including reduced risk of cardiovascular diseases. Now let's look at yoga for breastfeeding support. So certain yoga poses that involves chest opening and gentle stretches of the chest muscles can really help stimulate the blood flow to the breast and also encourage milk production. Deep breathing can really help new mothers to feel more at ease during breastfeeding, and incorporating mindfulness meditation in daily routine can also help mothers remain present and focused during breastfeeding, and it can reduce distraction and increase relaxation. So during breastfeeding, maintaining skin-to-skin contact can promote a sense of security and connection for the baby. Then pelvic floor health after childbirth. So some of the common issues and the importance of pelvic floor health after childbirth would be these. One is urinary incontinence. So one of the most common issues after childbirth is urinary incontinence, which is an involuntary leakage of urine. Weak or damaged pelvic floor muscles can lead to bladder control problems, particularly during activities like sneezing, coughing, or exercising. Then pelvic organ prolapse. Pelvic organ prolapse occurs when the pelvic organ descends and pressed against the vaginal wall due to weakened pelvic floor muscles. We have discussed this in the anatomy of pelvic floor in the pelvic floor specific chapter. And this can really cause discomfort and pressure on the pelvic or feeling of heaviness in the pelvic area. Then bowel dysfunction. So weak pelvic floor muscles can also lead to bowel dysfunction, including difficulty controlling the bowel movements and also experiencing fecal incontinence. Sexual dysfunction. So pelvic floor issues can affect sexual function, which can lead to pain or discomfort during intercourse and decreased sexual satisfaction. Then lower back pain. So weak pelvic floor muscles can contribute to lower back pain and also pelvic instability and affect overall posture and mobility. Emotional impact. So pelvic floor issues can have emotional impact and can lead to feelings of embarrassment, frustration, and reduced self-confidence. It can also impact the quality of life. So pelvic floor problems can significantly impact the mother's quality of life, and which can affect her daily activities, relationships, and overall well-being. So let's look at the importance of pelvic floor health after childbirth. So by taking care of the pelvic floor health, pelvic floor muscles, mother can reduce the risk of developing problems like urinary incontinence, pelvic floor prolapse, and sexual dysfunction, etc. that we just discussed. So maintaining a pelvic floor health is really crucial for recovery and healing. So strengthening the pelvic floor muscles can really aid in recovery and healing after the childbirth. Then it can also help with bladder and bowel control. So strong pelvic floor muscles can improve bladder and bowel control and can reduce the risk of incontinence and other related issues. So it can also support with pelvic organ prolapse. So a healthy pelvic floor provides a vital support to the pelvic organs, which can help prevent that. And then a healthy pelvic floor muscles would have a good impact on the sexual function and the pleasure. It can also contribute to better posture and core stability and overall body alignment. And then it can also help boost confidence and emotional well-being, and also reduce negative impacts of mental health. So addressing the pelvic floor health can really lead to improved overall physical function, greater comfort, and also enhance the quality of life for the postpartum mother. And during pregnancy and childbirth, the pelvic floor muscles undergoes significant stretching and strain, which can lead to various issues if not properly addressed. So pelvic floor exercises, which are commonly known as Kegel exercises, can really help strengthen the pelvic floor muscles. So these exercises involve contracting and relaxing the muscles that support the bladder, uterus, and the bowel. Strengthening the pelvic floor muscles can improve bladder control and support organ function. And keeping the area clean using peri-bottle with warm water and taking a sitz bath can really aid in healing and reducing this discomfort. In the early postpartum period, it's really advisable to avoid heavy lifting as it can strain the pelvic floor muscles. And proper hydration and regular bowel movements can really help prevent constipation and also reduce strain on the pelvic floor muscles. So what you can do as a yoga teacher is really train the mothers in the Kegel exercises or Mula Bandha, and let them know that it's very crucial that even if they're by the time they cannot join the yoga classes again in the postpartum periods, they can start to practice Mula Bandha during the early postpartum period itself to support their pelvic health. Now let's look at the nutrition and the nourishment. So proper nutrition and nourishment during the postpartum periods are of utmost significance for the well-being of both mom and the baby. And some of the key reasons why proper nutrition is crucial would be these. First, it promotes physical recovery. So proper nutrition provides essential nutrients that aids in healing and recovery process after the birth. And adequate intake of nutrients like protein, vitamins, and minerals support the tissue repair and also help replenish nutrient stores. And also it boosts overall energy levels. Then it also supports in breastfeeding. So for breastfeeding mothers, maintaining a balanced diet is really vital, as breast milk production requires extra calories, protein, and specific nutrients like calcium and omega-3 fatty acid. So a well-nourished mother is more likely to produce an adequate supply of nutritious breast milk for the baby. Then enhance immune function. So a nutrient-rich diet can strengthen the immune system and help new mothers to recover from childbirth and also reduce the risk of infection during the vulnerable period. Then it can also help manage hormonal changes. So proper nutrition plays a crucial role in hormonal regulation, which can help manage postpartum hormonal fluctuation and mood changes. And it can also help prevent postpartum anemia. So adequate iron intake is very crucial during the postpartum period to prevent or address postpartum anemia. It's a condition very common to new mothers. Then it also supports mental health. So nutrient-dense foods can positively impact the mental well-being and also reduce risk of postpartum mood disorders like postpartum depression or anxiety. And it also promotes healthy weight management. So proper nutrition supports healthy weight management after childbirth, which can aid in restoring pre-pregnancy weight and also reduce the risk of long-term weight-related health issues. It can also provide sufficient energy. So the postpartum period can be physically demanding with sleep deprivation and the demands of caring for the newborn. So a nourishing diet can really ensure that mothers have the energy that they need to meet the demands of her daily routine. So some of the things that mother can do for mindful eating during postpartum period would be these. So first is to choose nutrient-dense foods. So focusing on nutrient-dense foods like fruits, veggies, whole grains, lean proteins like poultry, fish, legumes, tofu, healthy fats like avocados, nuts, and olive oil, and then also include omega-3 fatty acids in her diet. So omega-3 fatty acids are found in fatty fish like salmon, flaxseed, and chia seeds are really important for the brain health of a mother and the baby. And then consuming iron-rich food. Iron-rich foods like lean meats, lentils, beans, fortified cereals, leafy green vegetables that will really help prevent postpartum anemia. Calcium intake. So adequate calcium intake is crucial for bone health and breast milk production, and this might include dairy products, calcium-fortified foods, or calcium-rich plant-based options are like fortified soya milk or tofu. And then vitamin D, ensuring sufficient vitamin D intake through sun exposure or supplements, as it's really essential for the calcium absorption and overall health. Then snacking smartly. Choosing to have healthy snacks like fruits, nuts, yogurt, whole grain, crackers to keep the energy levels stable throughout the day is really crucial. And limiting highly processed foods. So minimize the intake of sugary and processed food, as they may offer little nutritional value and can negatively impact the overall health. Then the approach to mindful eating. So approach meals with awareness and presence. Taking time to savor each bite and paying attention to hunger and fullness cues. Chewing food slowly and thoroughly can aid in digestion and also better assimilation of nutrients. So let's look at the importance of nourishing the body and mind. So first is self-care and recovery. So nourishing the body with nutrient-dense foods really support postpartum recovery, and it can help replenish nutrient stores and boost energy levels. And it can also enhance resilience. So nourishing the body and mind can help mothers to cope with the demands of getting a newborn and also promote resilience during this transformative period. And then mind-body connection. So mindful eating and nourishment cultivates a deeper connection between the body and mind, and this can foster overall well-being. I really hope this was informative for you and you can contribute to the life of a newly made mom, and during her postpartum journey you can support her through this information and understanding and provide her better care whenever needed. With that, thank you and namaste.